Hi everyone, my name is Dr. Daniel Skora with Fertility Specialists of Texas, and today I've been asked to answer some questions about surrogacy and the process of surrogacy for surrogates. In essence, IVF is a process by which we remove eggs from a woman, fertilize them, and place them back inside of someone to carry the eggs. And in the process of surrogacy, you really are doing the second half of the process. And this involves generally a frozen embryo transfer. Once the embryos are made and sometimes tested genetically to make sure they're normal, we then are ready to do the frozen embryo transfer on a gestational carrier or surrogate. The process for this is quite simple, actually. You come in for an ultrasound with a period and you're on birth control generally for a few weeks. You then take a medication called Lupron, which helps to prevent you from ovulating. And then you start taking estrogen via pill, sometimes vaginal suppository, sometimes injection, to help build the lining of the uterus where the baby will grow. Once that lining is measured via ultrasound, we then decide when to start progesterone injections to prepare the lining for the embryo transfer. The embryo transfer is done 6 days after starting the progesterone, and then we wait and see when a pregnancy occurs and how it's growing. Frozen embryo transfer process generally takes about 5 to 6 weeks from start of a period through a positive pregnancy test. Okay, so that's including all the steps that I previously discussed. Sometimes it takes a little bit shorter, sometimes a little bit longer. It all depends on how your body reacts to the estrogen and the medications that you're taking. Generally, no. So generally, we will only put in one embryo into most surrogates. If you have agreed to undergo a double embryo transfer with the intention of twins, most commonly that will result in a twin pregnancy. An unanticipated twin or triplet pregnancy is very, very unusual, less than 3% of the time. Generally, most twin pregnancies in a surrogate situation are a result of putting in 2 embryos. However, there is a slightly higher chance of an embryo splitting on its own with IVF and frozen embryo transfer. That chance is still extremely low, less than 3%. So the testing process for a surrogate is multifold. It starts with us reviewing your medical history and obstetric history. So looking at your previous pregnancies to make sure they were uneventful, that you didn't have diabetes or high blood pressure that would make surrogacy pregnancy difficult or complicated. When you come into the office, you really will see a doctor and we'll discuss the frozen embryo transfer process. And we'll do a special ultrasound where we do a normal vaginal ultrasound followed by a saline ultrasound, where we put a speculum in, place a small catheter through the cervix and inject a little bit of water. And that lets us expand the cavity so we can see if there are things like polyps or fibroids, which are benign tumors of the uterus, that might interfere in a pregnancy. This process also lets us see if it's easy to enter the uterus with that catheter, which is pretty much what we do when we do the embryo transfer. After that, the rest of the testing is all pretty much blood work and urine samples. So we're looking for sexually transmitted infections, and we're looking for a drug test that we do on all of our surrogates who come into the office to ensure they're good candidates to carry a pregnancy for our intended parents. The medications that you're on during the frozen embryo transfer, as discussed before, are generally birth control, followed by Lupron, which is a medication to prevent you from ovulating because we want to be in control, estrogen in one form or another, generally oral pills, and then progesterone injections, and those are intramuscular injections of progesterone and oil. Those are, for the most part, all the medications that you will be taking during the IVF frozen embryo transfer process. The restrictions of when you're trying to become a surrogate and becoming pregnant are pretty normal for anybody who's trying to become pregnant. So we generally recommend abstinence from sexual intercourse during the process of the frozen embryo transfer, and that's to ensure that it's the embryo that we're putting in that's causing the pregnancy, among other things. We also recommend abstaining from alcohol and drug use, etc., during the process of the frozen embryo transfer and living a healthy lifestyle. Your surrogacy agency will go over specific restrictions that are being requested by your intended parents, but generally from a medical standpoint, what we're looking at is just normal pregnancy restrictions during the whole process. So the process of the frozen embryo transfer, generally people do not have many side effects. Birth control in itself can sometimes cause people to have mood shifts and irregular bleeding. Depending on how you reacted to birth control in your past might indicate how it's going to be during the process. Some people are afraid of a medication called Lupron that we do use for downregulation and prevention of ovulation. The reason why people are worried is if they Google this medication of Lupron, they often see that it can cause menopausal type symptoms and vaginal dryness, mood swings, and things like that. Now, generally, Lupron is used mostly for patients who have endometriosis, and those are used in much, much higher doses than we use for frozen embryo transfer. So most of my patients do not have any side effects from the Lupron. Estrogen that we give also generally does not cause many side effects for women, and progesterone sometimes can cause weight gain, fluid shifts into the belly, mood shifts, etc. But I would say that the most common side effects that people have are normal pregnancy side effects. So things like nausea, vomiting in the first trimester are the most common side effects that people have. This is an important question for surrogates to understand, okay? If you're going to be a surrogate, what we're asking you to do is to carry a pregnancy. Now, it will not affect your ovarian reserve, the number of eggs in your ovaries, or your ability to conceive via those eggs in the future. If you decided to have this surrogate and then wanted to have surrogacy baby and then wanted to have your own baby, you should be able to. The question really becomes, will you still have your uterus after the surrogacy journey? There is a very, very small risk that in the pregnancy journey that you're going to undergo, you might have complications that might result in them having to remove your uterus. And that is a risk of pregnancy in general. So it is important to know that that is something that might happen very rarely, but it is something that might happen in the future that could inhibit you from having children in the future. Every medical clinic will have different pregnancy rates associated with their frozen embryo transfers, and they will go over those with you when you go and speak to them about success rates, etc. Generally, with gestational carriers, the pregnancy rates are very high, and those also vary based upon whether the embryos have been tested or not, as well as the quality of those embryos, etc. So I can't tell you how successful it is without knowing specifics of the specific cycle that you will be doing and where the embryo has come from. With a genetically normal embryo, a majority of gestational carriers will become pregnant the first time that they have a transfer, but this is not always the case, and it very much depends on all those factors that I discussed before. Most surrogates do not have to do more than one embryo transfer for a pregnancy, but it does happen that sometimes they do have to have more than one embryo transfer. So generally what we're looking for medically for a surrogate is someone who's had at least one previous normal pregnancy. No complications in that pregnancy like hypertension or high blood pressure, diabetes, small babies, delivering very early, difficult, complicated cesarean sections, and among other things that we're looking at that concern us for future pregnancies. What we want to see is that you've had a normal pregnancy in the past and you're likely going to have a normal pregnancy in the future. We generally want no one who's had more than 5 previous vaginal deliveries and no one who's had more than 2 previous cesarean sections. Those are things that we're looking for as well. Every time a cesarean section is done on anybody, the next one becomes more complicated and more dangerous for the person carrying the pregnancy. So if you are someone who's had, 2 vaginal deliveries, no complications, full term, you're not a smoker, you don't drink in excess, you don't do drugs, and you enjoy being pregnant, you probably are a good candidate to be a surrogate and to help a couple to become a family.